Hey guys, in this video we're going to talk about what to do for a hiatal hernia. Okay, this is a really powerful technique. You can give someone a lot of relief really fast. A hiatal hernia is a situation where your stomach is actually bulging up through the diaphragm. Okay, so right through here it's kind of coming up and it's creating a lot of congestion right here, and the valve doesn't close and you have stuff regurgitating back through here. You can call that GERD. But the point is that you need some relief, right? In addition to, regular increasing of apple cider vinegar and things like that, there's a manual technique that you can do. Now, right in the center, right below my rib cage, right in the center, okay, you have the sternum that comes down here. There's a little piece of cartilage. You don't want to press right on that, okay? So that's like right in the center. You want to do massage to the right of it and to the left of it. So the ribs come down through here. Okay, so right underneath your ribs, as you come right up through there, you want to press at an angle one at a time. Press right up underneath into this angle right through here to the midline, and you just want to press there. Now, a lot of you have the massage tool, and you can use the longer version as a tool, massage tool, to kind of gently press and hold up into that area right here. Now, you're going to feel it's just going to be tight. There's probably a lot of muscle guarding in there, but you're going to press this very gently and hold this for like 1 to 2 minutes, okay? And you're going to feel it's just going to relax. What we're trying to do is take this congestion and push it back down through here, okay? So now we'll take it to the other side and angle right in there. So now you're going to come this side, come up into that center part right through here. And right underneath the rib cage, you press underneath here. If you don't have this, you can use your thumb. And you press in there gently and just hold, okay? And you can go left and right, massage, and you're going to be fine as long as you don't press on the midline. So you want to come off the midline, so you don't want to hit that cartilage. And again, since you're pressing in there, you're not going to overdo it. You're just going to massage this area, and you're just going to create a lot more space so the food can actually come down here and that valve can close. Very simple technique. Again, you start on one side, right underneath the rib cage, let's say about 1 to 2 inches to the right. Press up in there, and you're pressing up at an angle right into the diaphragm, and you're just holding and pressing and kind of massaging through there to your own tolerance. Relax it, then do the other side. And you can do this just once a day for 1 to 2 weeks. And you're going to find that you're going to decongest this area and allow, just like any muscle that's in a tight knot, you're going to allow the muscles to have the proper tone, because you have a lot of muscles in this area, and to normalize. All right? So go ahead and comment below and share your experience when you do this technique. So I want to know what you're interested in as far as a future video. Click the link down below and share some ideas. I want to hear.